Hey guys, so I'm coming up on my 3 months post-op, and randomly I've been getting a few questions on Tumblr about Dr. McLean, so I thought instead of answering the same questions over and over again, I would just make a video about it, and then there would be something about him on YouTube, and maybe it would help some other guys out. So I've got 4 main questions that I've been asked in the past little while. The first one is, how much did it cost? McLean's surgery, I had double incision with nipple grafts, and it came to $7,345. And that's for the surgery, the anesthesiologist, and for a biopsy that they do that has to be done legally of the tissue that they take. So that includes all of that. I also had a slight complication. I had a hematoma, and I'm pretty sure that that was not included in the price, but my dad paid for that, so I'm not 100% sure how much extra he had to pay, because I did have to go under again for that. So the surgery itself costed $7,345. He requires a 10% down payment, so about $735 within a week of booking the appointment. So once you book your surgery date, you have a week to pay that down payment, or else they give the date to someone else. So that's the cost. The second question that I am asked a lot is why I chose McLean. Well, originally I was interested in him solely because of his location. I have had surgery in the past and have had complications with it, so being close to home for me was really, really important. The surgeons that I was considering at the very beginning were McLean, Garamoni because it's Garamoni, and the Montreal surgeons. So the Montreal surgeons and McLean were most appealing based on location alone. The Montreal surgeons did not have enough results that were visible to the public for me to be comfortable with them. And then after doing a lot of research, I realized that I actually really loved McLean's results. So I decided to choose him. His nipple placement is always perfect. All the results that I saw from him, his nipple placement was really, really good. And what I loved about Garamoni was his scar placement more. But in the end, I decided that nipple placement was more important because with the surgery that I had had in the past, my scars actually healed really, really nicely and didn't really show that much after 2 years. So I'm hoping the same thing is going to happen for this, and that the scar placement won't really matter that much. So I was really more focused on how important nipple placement was, and so that's why I chose McLean. The third question is, what is different from the way McLean operates to other surgeons? Well, because I was only really looking at Garamoni and McLean, I only know the differences between those two surgeons. And the main one is that Dr. Garamoni uses drains and Dr. McLean uses internal sutures. So why do those things even need to be done? Well, basically, when they take away the tissue, sorry to use the word, the breast tissue, there becomes a little gap between the skin and the muscle. And because of that, there's potential for fluid to build up and for hematomas to form. So what Garamoni does is right after the surgery, he inserts drains that drain into like the little grenades that you see guys have on the side. So all the fluid goes into there, and then a few days after surgery, you take those out, and hopefully all the fluid is gone, so there's no possibility for more fluid to build up. Instead of using drains, what McLean does is he does internal sutures, which means he takes the skin from the inside and sews it pretty much to the muscle so that the gap gets flattened and there's not really any possibility for fluid buildup. Having said that, it's still possible. I'm proof of that because I did have a large hematoma that formed. When that happened, he did insert a drain, not with like a grenade like Garamoni does, but just a drain that kind of he like poked it into the skin and bandaged it up, so it would just like, if it leaked at all, it would just leak into the bandages kind of, and then that wasn't satisfactory, so he did have to remove it surgically, remove the hematoma surgically. So that's not a reason not to go to him though. I mean, the internal suture method works for, I'd say 95 to even 99% of guys, so I wouldn't worry about that. I'm just always having complications with surgery. And then the last question that I've been getting is, do I recommend him? And the short version of that is 100 billion% absolutely recommend him. His clinic is hospitable. It makes you feel very comfortable. All his staff are above and beyond nice and professional. I really wish I had made this video closer to when I had had surgery so that I could give you guys actual examples of how nice they are. I dealt with 3 people, well, more than 3 people, but 3 main people at his clinic. McLean himself, one of the nurses whose name is Lorelei, and the office manager whose name is Liz. When I first chose him and had my phone consultation and booked surgery, he eventually decided that he did not want to operate on me because of the previous complications I'd had with other surgeries. But after kind of pushing and doing some medical tests and blood tests and all that type of thing, Liz eventually convinced him to reconsider, and he did, and then he eventually said yes. So essentially without her, I would not have had surgery with McLean, and I probably still would have not had surgery at this point 3 months later. So I'm extremely grateful to her. All of the staff is super, super nice. When I walked in, they all gave me a hug because they were so excited to meet me. Like, it's a really, really, really nice atmosphere. You don't have to worry about a thing. They take care of everything. They answer all your questions. I had some, like, weirdness because my dad wasn't 100% good with my name yet and my pronouns, but they like deal with it so much that they just kind of ignored him whenever he used the wrong ones, and they would always use Clark and they would always use he. So they're very professional and very, very, very nice, and I would highly recommend them. So those are the 4 questions I usually get asked about him. Like I said, I'm 3 months post-op now, so I guess I'll show you guys my chest so you can see what some McLean results look like. So that's what I look like now. Depending on the size of your chest, McLean will either make 2 incisions or an incision all the way across, which is what I have. Basically, it was a combination of my own anatomy and the fact that I had a breast reduction in the past, so I had kind of puckering in the middle already, so he had to make an incision all the way across, which I was fine with because I don't care. I get them removed, so that's all I really cared about. So that's what my nipples look like now. They're healing pretty well. The scars are healing pretty well. I still have some puckering in the middle, and I have kind of like a little bump here still. That's where the hematoma was actually. But I don't think it's any residual swelling. I actually think it's just a zit. So yeah, I mean, that's what it looks like. I'm really, really happy with it. The internal sutures that he uses start dissolving at the 3-month mark, so I should be feeling some things happening soon, and my range of motion should be increasing soon. As of now, I could, if I'm lifting both of my arms, this is as high as I could go just because it still feels a little bit uncomfortable. If I'm doing one arm at a time, I could go a bit higher, and if I hold where the incision is, I could go a bit higher than that, but I think that's more of like a psychological thing than an actual physical limitation. So yeah, highly recommend McLean. If any of you guys have any more questions about him, please feel free to ask me. I'll put my Tumblr, blog, link, whatever below, or you can message me on Facebook or on YouTube. I'm always happy to answer questions about him. And yeah, so I hope that was helpful to somebody at least, and I'll talk to you guys soon.